All right, let's talk about something that's probably sitting in a lot of our medicine cabinets right now. Today, we are cracking open that familiar orange box and demystifying one of the most common over-the-counter medications out there, DayQuil.
It's the absolute worst, isn't it? You feel awful, but the world doesn't just stop. You've got work, you've got meetings, you have a life to live, and you need something that's going to help with the symptoms but not put you to sleep at your desk.
So what's really going on inside that little orange capsule or that cap full of liquid? Let's pull back the curtain and break down exactly how DayQuil is supposed to get you through the day. First up, the key promise is right there in the name. It's for the day. The whole point is that it's specifically designed to tackle all those nasty symptoms without that sleepy, drowsy feeling that can completely derail your day. And what symptoms are we talking about? Well, all the usual suspects when a cold or flu hits. It's built to give you temporary relief from fever, that hacking cough, a stuffy nose, and just that general feeling of misery from aches, pains, headaches, and a sore throat. So how does one medicine do all of that at once? Well, the magic, if you want to call it that, lies in its three active ingredients. Let's dig into the science of what you're actually putting into your body. The first heavy hitter is acetaminophen. You probably know this one. It's your go-to for bringing down a fever and taking the edge off those minor aches and pains. Basically, it works by telling your body to chill out on how it senses pain and helps regulate your internal thermostat. Next, we have dextromethorphan. Now, this one is pretty interesting. It doesn't actually treat the cause of your cough. Instead, it goes right to the source in your brain, the part that controls that coughing reflex, and tells it to calm down, giving you a much-needed break so you can actually concentrate. And finally, there's phenylephrine. Think of this as the traffic controller for your stuffy nose. It's supposed to reduce swelling in your nasal passages so you can breathe easier. But, and this is a big but, it's worth knowing that an FDA advisory panel recently concluded that this specific ingredient, when taken orally, might not actually work as a decongestant. It's still in DayQuil, but that's a key piece of new information to keep in mind. Okay, now that we know what's in it, let's get practical. How do you take it correctly? Because following the dosage instructions isn't just a suggestion, it's absolutely critical for making sure it's both safe and effective. So for adults and kids 12 and over, the standard dose is 2 liquid caps or 30 milliliters of the liquid, and you take that every 4 hours. Now pay attention here. The recommendations change for younger kids, and for any child under 4, it's a definite do not use. But the most important rule of all? Never ever take more than 4 doses in a 24-hour period.
And here is a number I want you to remember: 2. If your symptoms are hanging around or even getting worse after 2 days of taking DayQuil, that's your sign. It's time to stop taking it and call your doctor.
Okay, let's talk about something really, really important. Like any medication, DayQuil comes with a list of potential side effects, and it can interact with other drugs you might be taking. This part is crucial. You've got to know the difference between common side effects and a true medical emergency. You might feel a little dizzy or nervous, that kind of thing can happen. But if you see any signs of a serious allergic reaction, we're talking a rash, hives, swelling, or any trouble breathing, that's a stop everything and get medical help immediately situation. It's also so important to know what DayQuil doesn't mix well with. It can have some really serious interactions with other drugs, especially things like blood thinners or certain types of antidepressants. This is not something to guess about. If you are taking any other medication, you have to talk to your doctor or pharmacist first. And this one is a big deal. The acetaminophen in DayQuil, when it's combined with regular heavy alcohol use, can put you at serious risk for liver damage. So the rule here is incredibly simple. If you're a person who has more than 3 alcoholic drinks a day, DayQuil is not for you. All right, our final section is all about the most important safety warnings. Think of this as being a smart, informed consumer when you're standing there in that pharmacy aisle. Please remember this number, 4,000 milligrams. That is the absolute maximum daily amount of acetaminophen you should be taking from all sources. And I mean everything. It's hiding in a lot of other medications, so you really have to be careful that you don't accidentally take too much. Look, DayQuil just isn't for everyone. If you have a pre-existing condition like heart disease, high blood pressure, diabetes, or liver problems, the active ingredients in DayQuil could actually make things worse. This is where a quick chat with your doctor is absolutely essential.
This quote is a really stark reminder of why taking this medication only as directed is so, so important. Misusing the dextromethorphan in DayQuil is dangerous. Taking more isn't better, it's just more dangerous, plain and simple.
And that brings us to the final question, right? After looking at what it does, how it works, and who really needs to be cautious, hopefully you can make a much more informed decision for yourself.
But here's the most crucial takeaway of all. This whole explainer is designed to give you information, but it can never, ever replace professional medical advice. If you have any doubt, any question at all, the smartest and safest thing you can possibly do is just talk to your doctor or pharmacist.
Thanks for tuning in.